Good evening everyone. So today's video is about the most repeated question for NORCET 2026. The first question of the day is, okay, now the question 1 is, a man sustained a fracture at the surgical neck of the humerus. Afterward he had the difficulty in abducting his arm from the side. So you have to tell which nerve is injured. Options: axillary, radial, median and ulnar. So the options, from the options we have, the answer is A, the axillary nerve, because the axillary nerve it surrounds the neck of the humerus. ठीक है, humerus के neck को wrap around the this humerus. So and it also supports the deltoid muscle. ठीक है, deltoid muscle को support करती है in abduction of the arm. So when this nerve is damaged, there is problem in the abduction. Okay, the right answer will be A. Now the next question is, now the question number 2. During a lumbar puncture, the needle is inserted in the midline between L3 and L4. Which structure is the final layer the needle passes before entering the subarachnoid space? So this is the lumbar puncture is done here. It is done at L3 and L4. So in the question it is asked that in which space the needle is inserted, right? So it is the dura mater, arachnoid mater, pia mater and ligamentum flavum. So क्या है? सबसे पहले है we will the layers कैसे होते हैं? DAP, DAP is dura mater, arachnoid mater and pia mater. So where in this the needle is inserted? And one more thing before answering the question, what is ligamentum flavum? What is ligamentum flavum? Ligamentum flavum is this part, right? This is one vertebra, vertebra, this is the third one, right? And this portion, this is called the ligamentum flavum. This helps in what it does, it helps in the flexibility में help करता है of the vertebra. ठीक है, एक posture देता है, it gives the posture and it also helps in flexibility to the vertebra. Okay, now the question is, where in L3 and L4 where the needle is inserted. So this is the needle. Needle is inserted at subarachnoid space. How? There is a layer, right? This is the dura mater. This is, we have arachnoid, then we have pia. So we learn it by DAP, right? So where is the subarachnoid space? Subarachnoid space is between arachnoid and the pia. Means it is located here. So the needle is inserted, the CSF is collected from this layer. Right? This is the subarachnoid layer. So here the needle is inserted here and this is the subarachnoid layer, right? So the answer of this question is the subarachnoid layer. Now the question number 3. A newborn fails to pass the meconium within 48 hours and has abdominal distension. X-ray shows a narrow distal column. Which congenital condition is most likely? Paralytic stenosis, Hirschsprung's disease, interception, Meckel's diverticulum. So when we see this, the congenital anomaly is, the answer is the Hirschsprung's disease. What is Hirschsprung's disease? It's a congenital anomaly. Okay. So what happened in this? The distal colon is get obstructed, जिसकी वजह से क्या हो जाता है? The stomach is distended. The child is having vomiting, is not able to pass meconium, is constipated. ठीक है, constipation होगा, abdominal distension, this will be there. But why is it happen? It is happened because there is no nerves involved here. There is a ganglionic part is there. ठीक है, a ganglionic part होगा, and because of this a ganglionic part there is no nerves, so there is no muscles are active here, and the muscles contraction is very much required in this region to push through the stool, to push through the indigested food. So यहाँ पे इसकी जरूरत है. तो but there is no nerves, a ganglionic part is there. So what is the treatment? हम कैसे उसके treat करेंगे? For the treatment we have to remove that a ganglionic part and we have to connect this with the healthy portion. ठीक है, हेल्दी पोर्शन के साथ कनेक्ट कर देंगे एंड एक ganglionic पार्ट को वी विल रिमूव. सो क्या होगा, देन द बेबी इज एबल टू पास द stool. So this is Hirschsprung's disease. Okay. Now the question 4 is, after an accident, a patient's right pupil remains dilated and does not react to light while eye movements are limited. Which cranial nerve is most likely affected? So we have cranial third, fourth, then we have sixth and fifth. So the answer of this question is cranial nerve third. So which one is the cranial third? That is the oculomotor. So oculomotor nerve, this is a mixed nerve that is responsible for the pupils constriction. ठीक है, pupil की constriction के लिए responsible है. It also helps in the accommodation में भी help करती है, lens accommodation. ठीक है, and eye movements में, especially the elevation of the eye movements. So the answer of the question is this one. Now the question number 5. A patient complains of burning sensation in the chest after meals worsen when lying down. Which anatomical structure is likely weakened? So here options pyloric, lower esophageal, upper esophageal, ileocecal. So answer will be lower esophageal sphincter, because when it is weak it leads to acid reflux. ठीक है, and when there is acid reflux then it leads to gastroesophageal reflux disease, and this is because of the weak lower esophageal sphincter. So answer will be B. So thank you so much. I'll meet you in the next video with some most important questions. Till then, keep evolving, keep practicing, and keep sharing the knowledge. Thank you so much.